Good morning, sir. Ako dahil si Nicole Marie Arellano. Before mo continue, kay unsa gani atong full name?
Albert E.
So karon sir, mag-physical examination ta sa imong ears, nose, sa imong mouth, ug sa imong throat, apil na imong neck. Okay ra ba nimo, sir?
Okay na.
Kung sakitan ka or kanang dili na ka comfortable kay pwede ra ka moingon para makaundang ta og magpaway sa. So sir, naa ba kay lain mga pangutana? For the positioning, the drop light must be behind the patient, opposite the head mirror, as to reflect the light. And the legs would be on one side and parallel to the patient's, as to not straddle the patient. So for ear examination, the materials needed are otoscope and tuning fork. So first is to inspect the auricle for any lesions or masses, and then palpating the auricle for any tenderness as well as the tragus. So for otoscopy, we need to choose the biggest speculum that could fit into the patient's ear. Then we need to hold the otoscope like a pencil, and we need to anchor it with 1 or 2 fingers against the cheek of the patient, as to prevent further pushing into the patient's ear in case the patient suddenly moves. So before inserting, we need to pull the auricle backwards and upwards to straighten the ear canal. So in doing otoscopy, we need to inspect the external auditory canal for any swelling or narrowing, if there are any discharges, or if there is presence of serum, as well as the tympanic membrane for its color, fullness, translucency, and if it is intact or perforated, as well as the cone of light. After you're done with one side, proceed to the other side. Next, we need to test for hearing loss using the Weber and Rene test. Clinic butang nako kay ing nako if asa ang mas kutsog nga sound. Kani sir nga test kay ing nako if mawala na pagbutang nako diri nimo, and then after ana kay ing nako if mawala na sa lumban. So the results are both ears with no lesions or masses, patent external auditory canal, no cerumen, no discharge, intact tympanic membrane with distinct cone of light, Weber test negative, and Rene test positive. For nose examination, the material needed is nasal speculum. So first, we need to inspect any gross deformities, lesions, or masses, and we also ask the patient if there are any area of tenderness. After which, we need to palpate any type of deformities, bone discontinuities or crepitus, as well as the sinuses for any tenderness. So next is we check for patency by asking the patient to cover one side. So next is we do the anterior rhinoscopy using the nasal speculum. So we need to hold the nasal speculum using the dominant hand and insert it with the blades closed. Once inside the nose, we will open the blade. In anterior rhinoscopy, we check for the nasal septum, the floor of the nose, the inferior turbinate, the middle meatus, and the middle turbinate if seen. And in removing the nasal speculum, we partially close the speculum to not pull the bursae. And we do this on the other side as well. So the results are both nasal cavities are with no lesions or masses, a midline nasal septum, and the turbinates are not inflamed, no bleeding, no discharge. So for oral cavity examination, the material needed is a tongue depressor. So in inspecting the patient's mouth, we need to inspect first the lips and then the teeth, as well as the ridges, the hard palate, and then the buccal mucosa, as well the anterior 2/3 of the tongue. That's why we need to ask the patient to stick out his tongue to assess for symmetry, mobility, fasciculations, and if there are any abnormalities. The floor of the mouth, by asking the patient to elevate the tongue. We also depress the tongue using the tongue depressor and letting the patient say ah. Inspect the soft palate, the tonsils, the laryngeal arches, and the uvula. So the results are complete dentition, no masses, no lesions, tonsillar grade 0, and no tonsillar exudates seen. So for posterior rhinoscopy, materials needed are nasopharyngeal mirror and tongue depressor. So before starting, we need to pre-warm the nasopharyngeal mirror against the hand to prevent fogging.
Sir, kanina examination kay ibutan lang ako sa sulod yung mga babaan. Tingnan ako if kanang sakit or di ka comfortable para maka
So the results are no masses, no bleeding, and no discharge. For indirect laryngoscopy, materials needed are laryngeal mirror, tongue depressor, and gauze. So we need to tell the patient to position himself by leaning forward and with his neck slightly extended, or the sniffing position. So we hold the tongue between the thumb and the index finger using a gauze, and then we retract the upper lip with the index finger. And then we put the laryngeal mirror inside and inspect the vocal cords and the surrounding structures by asking the patient to say E. We also check for its mobility. So the results are intact vocal mobility with no masses, no discharge, and no bleeding seen. Next is the neck examination. So it's either the physician is in front or behind the patient in doing this examination, and we need to position the patient with his head slightly flexed. So we need to palpate by manually alternating to one side and then to the next, and we need to avoid palpation too firmly or too deeply, and simultaneously to avoid vasovagal syncope. So next, we palpate the thyroid gland by first palpating the thyroid cartilage and then the cricoid cartilage, and then going down further to the isthmus of the thyroid gland. And then we ask the patient to swallow to assess for its mobility, and then we palpate each lobe to assess for consistency and if there are any nodularities. So the results are no lesions, no masses, no palpable lymph nodes, and non-palpable thyroid gland.